Hi teacher, this is the third exercise of the unit 1. 3.1. Label the diagram using word for the box. 1. Windpipe. 2. Lung. 3. Lobes. 4. Diaphragm. 5. Airways. 6. Heart. And 7. Bronchus. 3.2. Marks the condition with the organs affected using your medical knowledge. Hepatitis affects the liver. Pneumonia affects the lung. Nephritis affects the kidney. Gastric ulcer affects the stomach. Cystitis affects the bladder. Angina pectoris affects the heart. Cholecystitis affects the gallbladder. Ulcerative colitis affects the large bowel. Three point 3. Complete the textbook extract. Examination of the abdomen. The examine to patient for enlarged abdominal organs. First feel for the abdomen and the gallbladder. On the right side. To do this, ask the patient to take a deep breath, while pressing with the fingers upwards and inwards. Next, feel for the right kidney and then cross over to the other side for the left kidney. Still on the left side, palp for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only filled if it is full. Over to you. Many patients do not know the location of function of the spleen or the pancreas. How would you explain them to a patient in English? Okay. The pancreas is a long, flat gland found in the abdomen. It is located behind the stomach and produces important enzymes from the digestion process.